What is coronary heart disease?
Coronary heart disease is when the blood vessels of the heart are narrowed or blocked due to various reasons, mainly due to cholesterol and calcium.
What are the risk factors that lead to coronary heart disease?
There are multiple risk factors which can lead to coronary heart disease. We usually classify them into two categories. The first category are the so-called modifiable risk factors, and the second are the non-modifiable risk factors. To name them, the modifiable risk factors are mainly diabetes, high blood pressure, high cholesterol, smoking, and stressful lifestyle. The non-modifiable risk factors are namely age, male gender, and importantly genetics as well.
How can we detect these risk factors?
The main detection is done for the so-called modifiable risk factors. So if you take one by one, cigarette smoking, of course, through a questionnaire or patient history. High blood pressure, we have to check, and I usually recommend that patients get their blood pressure checked, especially after the age of 30 years, that they should get their blood pressure checked regularly, maybe once in every few months. And cholesterol, we can check in the blood. There's a test called a lipid profile, which can be done in main hospitals, as well as blood sugar to detect diabetes can be done by doing a fasting blood sugar or the 3-month test called HbA1c. Stressful lifestyle, of course, can again lead to coronary heart disease, through speaking to your doctor. We can detect these type of instances as well.
How do we prevent coronary heart disease?
Prevention of coronary heart disease is a very important question, and we normally say this is a multidisciplinary task. So prevention of coronary heart disease is again based on the early detection of the certain modifiable risk factors which may lead to it. So for example, if it is a patient who is previously not known to have any of these, we should try to detect them early through screening programs. So we can do certain blood tests, for example, to assess if the patient has increased blood sugar levels. We do what we call a fasting blood sugar level, or a 3-month test called an HbA1c test. To detect high cholesterol levels, we check a lipid profile, as well as checking the patient's blood pressures. And I usually recommend that patients above the age of 30 should get their blood pressure checked ever so often, maybe once in every few months, because sometimes they do pop up without any symptoms as well. Cigarette smoking is another major risk factor, and it's important to detect these patients through a good screening program and questionnaires as well. And it's about, after detecting, if the patients do have these certain risk factors, we need to treat them aggressively. By treating them aggressively, we can prevent the occurrence of coronary heart disease as well.
How can we detect if a patient already has coronary heart disease?
The detection of coronary heart disease is basically dependent on a few things. The most important thing is we go by a stepwise approach. The first thing we do is we have a chat with the patient. We take a thorough history. So the patients will tell us that they have symptoms such as chest pain, especially chest pain when they exert themselves, such as walking, running, climbing stairs. After that, we do an examination, a clinical examination, where we check the blood pressure, we auscultate the heart to see if there are any sounds, and then of course we do certain investigations, certain tests. The tests again can be divided into basic investigations and more sophisticated investigations. So the basic ones will be a simple ECG, and then we move on to the more complex ones, such as a test called a 2D echocardiogram, where we can do a scan of the heart to see how the heart is functioning, to see the status of the valves. And then again, if there is a suspicion, we do a test called an exercise ECG or a treadmill test, where we do a similar type of ECG. However, we do it while the patient is exerting themselves, and if we detect any changes in these investigations, we can assume that the patient may be having coronary heart disease. If the tests do prove positive, the best way to detect if the patient has significant coronary heart disease would be to do a more invasive investigation. Options wise, there is coronary angiography as well as coronary CT angiography, which are more advanced investigations done only if necessary.